Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. A very good day for all of us. Please allow me to introduce myself. My name is Dewi Zakiawati from Universitas Pajajaran. First of all, I would like to thank the committee of Sabilulungan Dental Aidpol and Indonesian Dental Association Bandung District for giving me and my mentor, Dr. Yani Satyadi, the opportunity to present a case report entitled Oral Manifestation of Acute Leukemia in Children, Family Supernatural Belief and its Contribution to the Prognosis of the Disease. Cancer is a familiar disease for all of us. It was Hippocrates, the father of medicine, who used the word carcino or crab to describe how the disease spread. While leukemia means white and haema is blood, collectively, leukemia means neoplasm of the blood and blood-forming tissues caused by unknown etiology. However, several risk factors have been implicated, such as genetic, gender, where men are more prone than women, lifestyle such as smoking, alcohol, obesity, and etc. Cancer has been a conundrum in society. Many are believing that it is caused by a supernatural power, and thus they choose to treat the disease to a healer. Our objective is to give an overview of our manifestation of a childhood acute leukemia, as well as the extent to which family supernatural belief contributes to the prognosis of cancer. Global Can released a report in 2020. We can see how high is the incidence of cancer both globally and nationally. And for the childhood leukemia, the number is high with a concerning mortality rate. Our case is about an 8-year-old girl who was referred to our department with edematous gingiva and gum bleeding. The mother told us that it has been happening for the past 1 month. At first, she thought that it was only a common toothache and sore mouth. It was the dentist who encouraged her to investigate the underlying systemic disease, which might be the main cause. We found several findings as shown on the screen. A prominent reddish purple gingiva, which enlarged and bleed, you can see on the figure C and D. And the palate was a bit pale with a large area of ecchymosis. We also found that tooth 85 was already necrosis and causing local gum swelling, but there was no ulceration found at that time. The serological examination showed low and very low values of many parameters, while the granulocyte was high and the leukocyte was tremendously high, reaching more than 100,000 white blood cells per microliter, as I highlighted on the table. The diagnosis made based on the history and findings were listed here. AML or ALL are suspected as the underlying reason for gingival enlargement and gum bleeding. The patient was given transfusion and hydration by the pediatrician. We gave oral hygiene instruction and prescribed antifibrinolytic mouthwash for her gum bleeding and analgesic to ease the pain. The patient was scheduled for a bone marrow aspiration, but unfortunately the family refused it. Although we have explained the medical reason behind the child condition, the importance of diagnosis determination, immediate therapy needed, and also how serious her condition was, they were more convinced that the child was a victim of black magic, and therefore they need to bring the children to the medicine man as soon as possible. 1 month after hospitalization, we were deeply saddened by the news that the child had passed away. To start our discussion, there are 4 types of common leukemia classification. All types showed leukocytosis, anemia, and thrombocytopenia. Although all have their characteristic, it is ILM and AML are the types of leukemia commonly affected children, while the rest of the 2s are more frequent in adults or older adults. Looking at these demographic features, our patient has more similarities to AML. However, considering that there are other subtypes of leukemia, to get adequate treatment, the exact types should be determined by the bone marrow aspiration. The symptoms of leukemia depend on the proliferation of neoplastic cells and their impact on normal cells. Leukemic cells can invade other organs, as seen on the table, and it is corresponding to what our patients experience. Oral vision could arise in around 65% of all types of leukemia, but primarily in the acute stage, especially 90% of AML cases, and therefore can be important diagnostic indicator. These oral manifestations may be the result of direct infiltration of leukemic cells or secondary to underlying thrombocytopenia, neutropenia, or impaired granulocyte function. We instructed the mother to maintain the child's oral hygiene by using 0.9% normal saline, which can reduce the infection and unnecessary inflammation reaction. We also prescribed chlorhexidine digluconate 0.12% for additional antiseptic. Analgesic ibuprofen was also given as safe treatment for children, and Vaseline to moisturize the lips. Tranexamic acid was prescribed to stop the gingival bleeding as it serves as antifibrinolytic agent. It has been proven effective to control post-extraction or anastomomucosal bleeding. By controlling the spontaneous gingival bleeding, we hope to prevent the worsening of the systemic condition. Unfortunately, the patient was taken home before we had a chance to administer the medication. In high-income countries, the cancer life expectancy can reach up to 80%, when the middle and low-income country like us, it is only 10, maximum 30%. Generally, around 70% of ALL and 20% of AML patients will survive their leukemia for 5 years or more after they are diagnosed, and younger people have a better prognosis. The reason for lower survival rates include delay or inability to obtain accurate disease, inaccessible or abandonment of treatment, death from side effect, and avoidable relapse. Improving access to childhood cancer care is cost effective, visible, and can improve survival in all settings. Since our patient did not get the definitive treatment she needed, it is one of the vital factors of her survival. Cancer-related myth, taboo, and stigma are important problems that must be addressed. People around the world, including in Indonesia, still believe that the disease is often related to supernatural phenomenon, and this belief is part of the social and cultural aspect in the society which influence how people behave toward their illness. A study done by Saeed and colleagues in 2019 showed that more than 50% of cancer patients consider black magic and evil eye as the cause of the disease. Some cancer, especially in its advanced stage, has not been able to cure by modern medication. Perhaps this is also the reason why some people try to find other alternative ways which they consider as safer, promising, and affordable, despite no supportive empirical studies. This is exactly what experienced by the patient's family. We believe that their concern about the supernatural force causing their child cancer was the one driving them to seek alternative therapies. Nevertheless, this decision has a substantial implication on the patient's life expectancy. From this case, we may conclude that the common oral signs of acute leukemia in children are gingival enlargement and gum bleeding, and this is a crucial role for dentists in the early detection of leukemia. We cannot neglect that the supernatural beliefs regarding leukemia are still existing. Therefore, the dentist must be more persistent in educating patients and their families to receive definitive therapy in order to increase patient life expectancy. These are the references we use in this report. And please allow me to close my presentation by echoing the message from the WHO movement Cure All. If we act now, play our part as a dentist, we can save 1 million lives over the next decade. Thank you very much for your kind attention. Wassalamu alaikum warahmatullahi wabarakatuh.